Hi everyone, in this video we want to discuss the treatment of chickenpox with antivirals like acyclovir or valacyclovir. Chickenpox is a highly contagious disease caused by varicella zoster virus. However, not everyone needs treatment. By treatment I mean antiviral, not symptomatic treatment. In this lecture we want to learn who should receive antivirals in chickenpox. Main point to consider is that healthy children equal or lower than 12 years old do not need any antivirals for the treatment of chickenpox. Who should receive antivirals? The short answer to this question is yes, if first, pregnant women should receive treatment with acyclovir or valacyclovir during chickenpox. Another condition is unvaccinated adults or adolescents should receive antivirals for the treatment of chickenpox. Another condition is immunocompromised patients should also receive antivirals for the treatment of chickenpox. So, at the presence of any of these conditions, patients should receive antivirals. How long should they receive treatment? Treatment duration is different from 5 to 10 days according to the patient's immune status and recovery of the symptoms. Hope you enjoyed this video. Please like, subscribe and share, and don't forget to ask your questions in the comments. Thanks.